Welcome everyone to the Board of Health meeting of January 3rd, 2022. I'm Judy Giorgio, health agent for the town of Chatham. Please note that this meeting is being recorded and shall be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's June 16th, 2021 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of his March 12, 2020 order, suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20 until April 1st, 2022. This meeting of the Chatham Board of Health is being conducted via remote for public participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 508-945-4410 when the conference ID number is 668-414-608#, or join the meeting via online Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide real-time access. We will post a record of this meeting on the town's website as soon as possible. And I'd like to turn the meeting over to Chairman Beckley.
Thank you, Judy. It shall be the policy of this board to conduct its meetings under the Open Meetings Law so as to encourage public participation whenever time permits and as part of agenda item discussions. So before we start, let's establish that we have a quorum. So when I call your name, please indicate whether you're present. Dr. Noble Hanson.
Present.
Ron Broman.
Here.
Ed Sheehan.
Here.
Carol Joyce.
Here.
I'm here. And Dr. Richard Edwards. Richard, do you have your mute on?
No, Dick was not going to be able to attend the meeting.
Okay, thank you. I knew he was going to try to, but.
Oh, that's true, yep.
Okay, we have no hearings tonight, but we do have three important agenda items to discuss and update on. The first one is a discussion and an update regarding John McGrath's property at 32 Mill Hill Lane. And for that update, I'll ask Dr. Duncanson to share with us.
Good evening, members of the Board of Health, members of the public. As indicated at the last Board of Health meeting, there has been some minimal progress at the 32 Mill Hill Lane property. The town has received 2 bids for removal of the material from the town's right-of-way or within the road layout. Unfortunately, those bids were solicited verbally, and because of the cost involved, the proposal has to be made in writing. I confirmed that last week with the finance director, so we're making efforts right now to come up with basically a 1-page scope of work that we can send out to potential bidders to ensure that we're in compliance with the open meeting law. In addition, the scope has changed a little bit since those bids were first solicited because there has been, as we reported last time, there has been some cleanup that's taken place within the road layout. So we're in the process of developing that scope, getting that out, and getting new bids in here hopefully shortly. Obviously, we do have to comply with the procurement law, which does require certain time frames that we have to make those bids available. But hopefully, with the progress that's been taking place there, it will continue, and then we'll get those bids out and get them back in, as well as further discussion about a funding source to do that work, depending on how much it comes in at. I've already spoken with the finance director about that, and potentially it could be, depending on the amount, and the bids are coming in lower than some earlier projections. And if they come in even lower because the scope of work has actually shrunk a little bit, we may be able to accomplish it with a reserve fund transfer through the finance committee, which would obviously speed things up, substantially. So that's all I have on the 32 Mill Hill Lane as of today.
Okay, questions and comments from board members?
Yeah, this is Noble.
Go ahead, Noble.
Yeah, Bob, so written bids going out and then getting a reply. So if you don't have a third bid, will you be able to choose from two?
Yes, the procurement law says you only have to solicit a minimum of 3 bids. You do not have to receive 3 bids. So if we put the solicitation out and let's say we only get 1 bid, we can go with that. If we get 2 bids, we could pick between, well, in this case, we'd be picking the lowest bidder. But no, we do not have to get 3 back.
And then, so what's the time frame? Do you think these can go out and get back in a week, in a couple of weeks?
I think it will probably take a couple of weeks just to get it out and then get them back. I expect it will be a fairly quick turnaround time because obviously 2 of the prospective bidders have already bid. They just may need to revise their bid a little bit based on maybe a narrower scope because obviously, as we reported and as you've seen, some material has been removed from the road layout. So.
Okay, and then I think at the last meeting you indicated that, as I remember, that you thought we would be able to get funding through the reserve fund and not have to go to town meeting. Is it? You said this time May. Is that in question, or is it pretty much we're going to be able to do it?
It's never absolute until it's done. But I think given the fact that the bids are coming in lower than we originally anticipated, that getting a reserve fund transfer is a pretty good likelihood. It's like everything else. It depends on what else they may need the reserve fund for. But the smaller the number that we need to ask for, the better off.
And then is that a process where you can just go and present the bid and get an answer right away, or is that a time frame involved in getting the answer back from the town?
There would be a little bit of time involved. I mean, I would make the request to the finance director, and then depending on when the finance committee is meeting, and whether or not they need to call a special meeting to consider this if they don't have one scheduled. But as you know, we're right in budget season, so the finance committee is meeting pretty regularly. So I don't anticipate that being very long to get that approval one way or the other.
Okay, great. And then the last question is kind of open-ended from the last meeting, are the trailers there? Now, I drove by and it appears to me, I mean, just me, that one trailer looks like it might not be operable. It's a double axle trailer with just one wheel on each side, and I didn't see a plate on it. And then there are other trailers that may be look registered, and they're full of scrap metal. And then the junked car that looked like it was removed is actually now on a trailer sitting on the lot. So the question comes up, how are we going to deal with these trailers? The one that's not registered, can it be removed? Can the police department ticket some of that stuff? Is it going to be part of the bid process, the trailers? I mean, that's kind of an open question, I think.
Yeah, the only thing I can tell you at the moment is the last correspondence I had with the police department regarding the trailers was that as far as they've been able to determine, all the trailers are registered. They may not have had plates on them the day you were there, but the police department was going to remind Mr. McGrath that if they are registered, they do need to have plates on them. So they were going to be continuing to monitor that as the trailers got moved around and all. As far as the junked car, which appears to have returned, when I was there last, just before the holiday, it was up on a trailer. That trailer was registered. So in all likelihood, I don't believe there's anything we can necessarily do about that. But again, that's been brought up to the police department. And they were going to be reviewing that and then following through as necessary.
So as far as we know now, the trailers will be there. We won't be able to do much about that. He moves them around and they do obstruct the street a little bit. One of the residents complained about them. In a way, if you want to take the worst view of it, he's got this one trailer that's a sort of a metal scrap junkyard that's mobile. It's on the trailer and he's moving it around, so he sort of skirts the issue a little bit. But so what's your sense of whether this is something that's going to be able to be dealt with, or is just we accept it?
I think that's a topic I will try to have the police department at your next meeting.
That sounds good.
Because my understanding is if the trailers are legally registered, they can be within the road layout, because just like any vehicle, can be within, traveling on a road. But no, I'll reach out to the PD and see if I can get their representative at your next meeting to answer maybe some of these more specific questions related to the trailers.
Yeah, and I guess my last, real quick, I guess at some point these trailers could be legally, could they be a part of the nuisance, the nuisance statute? You know what I mean? At some point, maybe they would be. That'd be a legal question, I guess.
Yep, that would be a legal question. We can certainly direct that to town council.
Okay, thanks.
All right.
Bob, I have a question. Bob,
Go.
can the police put a no parking signs along there because of the width of that road? If those trailers can legally stay there, they can certainly make it no parking.
The issue of no parking signs as well as no dumping signs is under discussion within the town staff and all the various agencies as to whether or not, I shouldn't say whether or not, how helpful that will be to this situation. So again, at our next meeting, if we have a police department representative, we may be able to shed better light on that. The issue has been, and I'm sure the board's aware of this, there are potentially other locations in town with similar circumstances, maybe not as egregious as this one, obviously. And so, if we post this property with certain things, technically we need to do it at all locations or town-wide. So it doesn't appear that we're singling out a property or an individual. So those are all the items that, those kind of questions bring up that are being looked into.
Where else in town are they concerned about messes like that?
There are a couple other properties in town that have similar conditions, but again, nowhere near as drastic as this one. They may not be impeding necessarily in the road layout kind of issue, but there are some other properties that, this issue has kind of highlighted. We're also looking into a blight bylaw, whether something like that would be helpful, as they have in some other communities in Massachusetts and whatnot. So those things are all on the table.
Bob, I have a question. This is John.
Yeah.
Do we get from the successful bidder a time frame within which they can execute the bid, the contract?
I'm just scanning them real quick.
I mean, if they say, yeah, we'll do it for 20,000, but we can't do it for 12 weeks. I mean, that's a big difference.
Yeah, one of them indicated 2 days. One indicated 2 days and one indicated 3 days.
Okay, that's
and
good.
we would certainly put that into our scope, if you will, to say, that the town wants this done in 2 days, if we think that that's reasonable,
Right.
Based on what's left, or 3 days, or, a day or whatever. So we would put that in the written bid, because that's part of the issue when you only do verbals. Now we've got, two bidders that are basically saying different things, as opposed to, here's the written scope of work, you respond to that with the specifics that are in it. All right.
All right, but I think the issues that Noble has raised are crucial, both from an enforcement purview perspective and from a finalized bid spec perspective.
Mhm.
We've got to know what becomes of those trailers that are sitting there on the roadway. Can they stay there forever? Do they need to be removed by the contractor? This is pretty important to get a handle on before we proceed, at least in my opinion.
Okay, I will pose that question with town council.
All right.
And if you have any others, if any members have any other specific legal questions, if you want to get those over to me, then I can also pass those on to town council
All right.
for input.
Any other questions or comments for Dr. Duncanson on this issue? All right, let's move. Item number 2, discussion and an update regarding Chatham water quality. Dr. Duncan.
Okay. Yeah, since your last meeting, where I provided a fairly lengthy update, there hasn't been a whole lot of additional movement. I shouldn't say that. There's been movement, but nothing substantial that wasn't reported at the last meeting. As I indicated, wells 10 and 11, we're reviewing the 30% design plans for those with the engineer. Wells 5 and 8, the granular activated carbon vessel was ordered and is still anticipated for delivery in early April. Get that 5 and 8 up online for the summer season on a temporary basis, while the design of the permanent water treatment facility is completed and permitted and funded at town meeting, because that still needs to take place. But at least we would be able to get wells 5 and 8 back online, hopefully by summer, given our current drought situation and whatnot, and high summertime use. So that there really hasn't, there hasn't been a lot more to update you on since that last meeting, where a lot of those things were covered.
All right, thank you. Questions?
Yeah, Bob, has anything been done on that PF stuff that you were going to have someone come in and look at?
I'm still trying to work out the scope for that and get that out on the street. Hopefully that will happen here shortly. Between the holidays and COVID and everything else, it's just taking a little bit longer to get that refined and get it out. But no, we're still moving on that direction.
Okay, thank you.
All right. Anybody else have any comments on Chatham water quality? If not, we'll move across and we'll go to item 3, which is the COVID-19 update. Dr. Duncanson.
Okay, so as I'm sure you're well aware, just by listening to the news or reading the newspaper, things are not getting any better. Let me quickly share my screen here and share some of the latest graphics. Okay, can everybody see the first graphic, which is the COVID cases, confirmed COVID cases on a monthly basis?
Yes.
Yes.
Okay. As you can see, we ended December of this year, December of 2021, with a total of 112 cases. And that actually eclipsed the high that we had last year in January. In January of 21, we had 106 cases, and we thought that that was a high number. Well, we now ended December of 2021 with 112 cases. That's compared to 57 cases in all of December of 2020. So we've had over twice as many cases this year, or this past year, as we did in the previous year. We are currently at 563 cases total since the beginning of the pandemic, back in March of 2020. And as you can see, the number of cases that we've had and the number of cases that have been resolved, I've been pretty much mirroring what transpired in the previous month, because obviously some cases don't resolve until the following month if they are reported within the last 10 days of a month. When I looked first thing this morning, we didn't have any cases in January so far, but I think that was just an artifact of the weekend and the holiday and issue material not being uploaded into the state's website. So, but 95 cases in all of December 2021, so significantly higher than we've seen in the past. When we look at this on a percent positivity, we see this huge spike. This is data as of December 30th for the preceding 2 weeks. And it's actually through Christmas Day, through the 25th. So the data comes out on a Thursday, but it's through a prior date. So it's for the 2 weeks prior to that. So this doesn't even necessarily reflect, does not reflect the elevated counts that we saw last week.
What's that number? What's that number at, Bob? I can't quite see the detail.
Our percent positivity, well, on on December 23rd, it was at 6.26%. And on December 30th, it was 11.02%. And that was the highest, the second highest number on the Cape. I think the only town on the Cape that was higher was Truro, I believe. And then looking at the average daily incident rate, and as you've seen before, this pretty much mirrors the percent positivity. Our average daily incident rate on December 23rd was 31.9, and it shot up to 71.1 on December 30th. And these data cover that period from December 12th through the 25th. So it doesn't cover, if you will, the after Christmas period or the period just before New Year's. So, we're seeing the same thing that everybody else is seeing. We are seeing a substantial rise in the number of cases, as we're seeing both, on the Cape, in Massachusetts, and nationally. And most of these are attributable to the expectation is that most of these are attributable to the Omicron variant, which is, we've talked about before, is now the predominant variant in the country. Of the 112 cases that we had in December, 43 of those were in people that were not vaccinated or didn't indicate they were vaccinated when they were contacted. So slightly under half. So that means the majority of these cases are occurring in vaccinated individuals and people that had not only the 2-dose or the 1-dose, but had also received a booster shot. Of the 43 cases that were indicated to not be not vaccinated, of the 112 cases that we had in total, and 43 of those not vaccinated, that's 38% of the positive cases are in people not vaccinated. And when you remove 2 cases that were not eligible because they were in very young children under the age of 5, that leaves 41 cases, or 36% of the cases. 36% of the positive cases are in people that are eligible for the vaccine, but did not indicate they had had it or indicated they were not vaccinated. So that's where we are from a statistical perspective. We have been made aware of some incidents or some outbreaks, if you will, in local businesses that have sent, they did what they were supposed to do. They contacted us. They've taken the appropriate precautions, testing their staff, whatnot. And just to give you an idea of the seriousness of the situation, Chatham Bars Inn ended up canceling their New Year's celebrations. They were going to have some celebrations over New Year's and New Year's Day. They ended up canceling those because of the rise in cases and the easy spread of the Omicron variant, wanting to protect both their staff as well as attendees that would have been attending those events. So based on that, I distributed earlier today to the board. I'm sure the board's aware that the state and the feds have recommended that all individuals wear a mask. They have advised, they have not issued a mandate, but they have advised that all individuals should wear a mask when indoors. We've had some discussions about that, kind of internally and chatter from various staff, over the last week or so due to the rise in cases. And watching what some of the other towns have done, I distributed earlier today for your consideration a Board of Health order that would make wearing a mask mandatory inside town buildings. We currently have information posted, that based on the recommendations of DPH and CDC, you should wear a mask when you're inside. But I know some other towns have gone this route, including Harwich, which implemented an indoor mask order for their town buildings last Thursday, took effect on Friday. And so in response, I basically redrafted their order to make it germane to Chatham, and distributed that for the board's consideration. And basically it would require the wearing of a mask indoors in any town building or facility. The only exception would be for an individual who was in a private office. But if anybody came into your office, you would have to put on a mask, which is what pretty much that's been the status quo in town buildings for quite a while now. So anyway, and then the only other exemption would be obviously in accordance with CDC, if someone is under 2 or they physically can't wear a mask for whatever reason, they would not be required to do so. So I sent that out for the board's consideration as to whether or not you felt it was necessary or appropriate at this time to go that route. So back to you, John.
Bob, this is a couple of things. First, I see Dr. Edwards is on the call, so I want the record to show that he is in attendance at the meeting today. Richard, do you want to comment on this discussion?
Well, yes, I read the proposed regulation, and I really think it doesn't go far enough. I think that what I've heard is that Wellfleet, Truro, Eastham, and Provincetown have a mandate for masks in all indoor venues, including restaurants and shops. And I think since it's highly likely that this curve is going to continue to go straight up for the next week or two, and we're going to have twice as many cases 2 weeks from now as we have today. If we want to keep the businesses in Chatham open, and we want to have people in Chatham healthy, we need to reinstitute the mandate we had last year, with the exception of outdoor mask wearing. But I think certainly all employees in restaurants and shops need to be mandated to wear masks. And I would extend that to saying that everyone entering businesses in the town of Chatham should wear a mask, because otherwise we're going to have enormous numbers of people infected with this virus and not being able to work, and it's going to be a nightmare.
Well, thank you, Richard. I for one agree with that. I think with an Omicron surge at our doorstep, we really need to support any strategy that can help reduce transmission. And I agree, putting in place a temporary indoor mask mandate should help. And it's not that heavy a lift to ask the public to put masks on before they go into public venues. And I know I don't think this would have to be in place for long, because we're not expected to see an Omicron surge last that long. So we could put a time on it and schedule a revisit of it in several weeks if we wanted to. I'd like to hear from other members. Noble, do you have any comments on this? Or Ron?
Well, I go back to my comments about, EMTs and even probably the police department should have to wear masks if they're out there in public. I think I brought that up once before, because we don't know who's vaccinated and who's not.
What we're talking about now, though, is a mandate in indoor space in town. So it would extend not only to the town offices, but to all public venues, including, shops and stores.
I understand that.
Yeah. I think the merchants, I can't speak for the merchants, but if I were a merchant, I would welcome the tightening down of the mask mandate for a while. Other comments?
Yeah, this is Noble. Yeah, no, I agree with the comments that the other board members have made. I think with the surge that it's reasonable to make an order that masks are mandatory indoors in a publicly accessible building, whether vaccinated or unvaccinated. And I mean, entering a restaurant, but not sitting down eating. You can remove your mask as before to do that, so restaurants can continue their business. I think a lot of shops downtown already ask for masks. I have the sense that they will, it might be easier for them to just have an order. And so they're not putting the order themselves, but it's there already. I don't think there'd be a lot of resistance. I think people kind of expect it right now. And I think it's something that we can do. I agree with John. I like the idea of putting a time on it because, as I've said before, when we make an order, one of the hard things is when do we remove the order? So, I mean, I would go either way, but you could say we'll put it in for the month of January. We'll review it at our last meeting in January and see if we're going to extend it into February or not. And that shows, good faith that we will remove it when we can. Who knows? This Omicron numbers may come down dramatically. They may not. I had one. Well, I'll come at the end. I had a couple more questions of Bob about the numbers, but I can wait.
Let me ask, Carol's had her hand up for a while. Carol.
Yeah, well, I agree that we should probably put in a temporary mask mandate. And like Noble said, put a timeline on it for the month of January and see what comes of it.
Is that it? Thank you.
That's it.
Richard, your hands
Well,
up.
I just wanted to comment that I was quite surprised last weekend when I went to a Stop and Shop, and I see that although the majority of employees are wearing masks, no longer do all the employees wear masks. So checkers and baggers are not wearing masks. And I think it's just, if we want to protect the public health, we have to, I know Stop and Shop isn't in Chatham, but we need to have a rule if we want to keep the kids in school and keep the businesses operating. Yeah.
Yeah, this is John again. I think about the retail food establishments, and I agree that there should be an allowance, obviously, for somebody to take their mask off while they're eating and drinking. But I wonder in a bar setting, whether people take their masks off and then they mill around and they walk up to the end of the bar, they come down to the other bar, they visit people. And that to me is kind of violating the spirit of the waiver. And I wonder whether we ought to include any statement about while in a retail food establishment, after removing their mask, they should remain at their table or at their eating station and not interact. Maybe this is a petty point, but I was thinking about that.
Did we not have rules like that early on? And we had occupancy restrictions also to try to maintain some social distancing. You know, and now you look in the window of the Squire and you see people jammed in there, and nobody's wearing a mask. And so, you know, the other consideration would be to have occupancy or space restrictions and distancing. You know, every other seat, you know, 2 seats at the bar with a seat empty in between and things like that. Because otherwise we're just going to have everybody getting sick.
Dr. Duncanson, that's a good point for you, good time for you to weigh in on that.
Yeah, I was just going to comment. I'm looking at the Wellfleet mask update from back in November, and obviously this is before the Omicron really became the issue it is. But in food service establishments, they indicate that customers may only remove face coverings when seated. So, you know, I think that kind of addresses a little bit of the conversation the board was just having about bars and whatnot. You know, bars for the most part also sell food, so they would be covered. But I just want to throw that out there. They also include their language is basically whenever indoors on the premises of a business, club, or place of assembly, including but not limited to retail establishments, restaurants, bars, performance venues, social clubs, event spaces, places of worship, and municipal buildings. Food service establishment customers may only remove face coverings when seated. Lodging workers and guests are required to wear face coverings inside hallways and common areas. They then talk about personal services, including hair salons and massage/body work. Customers and workers are required to wear face coverings. And then masking remains mandatory for all individuals on public and private transportation systems. And that's still a requirement under the state.
I like the wording you referenced there regarding the retail food establishments.
Yeah, I'm looking at Wellfleets, and you can tell it's similar language to some others that I've seen. But we could certainly take this and, you know, adapt it for Chatham. One of the things that both the Wellfleet one and the Harwich one that came out last Thursday had was that they also talk about the 6-foot distance. And in some cases, I believe it was Harwich, you're not required to wear a mask if you can achieve that social distance. You know, I think that in some respects is the out for people. In some cases, they can claim, well, I was 6 feet away, I didn't need to wear a mask. I would suggest that we not go that direction, that if we're going to have a mask mandate, it should be, if you're inside a store, irrespective of your ability to social distance or a restaurant or what, you should still fall under the mask requirement. It makes it a lot easier, I think, for the public to understand. It also makes it a lot easier from an enforcement perspective. Because obviously, you know, one of the issues we always have with going in a direction like this is the enforcement. You know, we have experience from last time around, and Judy can attest to this. You know, we're the ones that get the complaints, obviously, because it's a Board of Health order. And, you know, we have limited manpower to respond to complaints and whatnot. And, you know, sometimes it's easy to do, other times it becomes more onerous. So What I would suggest, and if the board wants to go with kind of the town-wide mask mandate, that we draft something up quickly using maybe Wellfleet as the example, and circulate that around to the board. And then we can always call an emergency meeting for later this week, for you to review it and discuss it and then make a decision on adopting.
I'm fine with that. What do other board members think?
I think that's a good idea also, so we can see it before it goes out.
Yeah, this is Noble. I agree with keeping it simple. Indoors, wear a mask unless you're seated and eating. And that's, I think we'll get pretty good compliance.
Yep.
And it's what we had before. People understand it, they kind of expect it. So I agree basically with what Dr. Duncanson said. And I would like, if we're going to do it, we need to do it as soon as possible, get this thing out this week. So I would be in favor of having an emergency, virtual meeting and pass it once the draft is out.
I concur with that 100%. It's got to be done fast.
Yes.
Okay.
There's one other consideration. It's going to be a little dicey, but let me just say it. Cloth masks are almost useless with Omicron because of the highly transmissible nature of Omicron. The homemade or the double ply cloth mask is very, very ineffective. It's better than nothing, but not much. And so I would like to see us at least recommend, whenever possible, that either surgical masks or KN or N95 masks be worn. Because you're just fooling yourself if you're wearing a homemade mask made out of a pillowcase and you think you're protecting yourself or others from Omicron.
Well, I think that's a good idea, and recommend people use one of those masks, the KN95 or the other one, or surgical.
I'd be interested in Dr. Duncanson's comment.
And an N95 is a lot more protective than a surgical, isn't it?
Oh, yes, right.
Isn't
the N95s are a little more difficult to get and a little more expensive. The surgicals are at least pretty much available everywhere now. And even the surgicals, there are different levels of surgical masks.
Okay.
Yeah, so it's complicated. But the cloth masks just don't really.
What about, I've read about the enhancing of protection by doubling up on the cloth masks. Is that something that we could reference as well as a strategy, or is that useless? I don't know.
I don't think it's very effective. If you wear a surgical mask over a cloth mask or a surgical mask over an N95, you're adding protection. I don't think 2 cloth masks will help much.
This is Noel. Yeah, I think, like I said, keeping it simple, I think if we put in a recommendation or just a note that a cloth mask or surgical mask is more effective than that the paper mask, the surgical mask is more effective than the cloth mask. And it's just as an advisory, but not and keep it simple like that, and not make it a mandatory thing, just a point of information that's included. I would agree with that.
An N95 is the gold standard, though, isn't it?
Yes.
Well, even an N95, but those are not.
And people can't get them.
N95
Right.
is not a medical mask. It's a dust mask,
Okay.
but it's pretty effective. And just as an aside, that they are becoming quite readily available. Ocean State, you can order 25 KN95s for delivery in the store for $25 with a $25 gift certificate. So they're free. If you really want to get one, you can get one.
and get them online also.
So I'm open to a suggestion of exactly what would be the best wording to include in our order if we wanted to reference or recommend an upgraded mask. Or we just
Well,
ask,
I would say that in the mandate, that the Board of Health strongly recommends that the mask be either a KN95, N95, or surgical mask.
okay. That sounds good to me. How does everybody else respond to that, including Noble? You're a physician.
I think that the order would be the mask or cloth face covering inside, and then the board recommends a surgical mask if possible, something like that.
So you're saying the cloth mask would be acceptable?
Cloth, yeah, a mask or what we've done before, mask or cloth face coverings must be worn indoors. The board recommends a surgical mask if at all possible, but not order that. That's a big jump up, and I'm not sure that we'd get a lot of compliance with that. To say, you have to wear a surgical mask always.
Richard?
Yeah, no, I wouldn't mandate that only a surgical mask should be worn. I would say the board mandates that masks be worn indoors and strongly recommends that the mask be either a surgical mask or a KN95 mask.
Yeah, that's the best way to have it.
Carol?
Yeah, I agree with what Richard just said, that you just mandate that a mask be worn, and to recommend or reference the surgical mask or the KN95, but not to mandate that type of a mask. I mean, unless you're going to require every business in town to be handing them out.
Yeah.
What does the K relate to? K?
Korea. It's the Korean standard. So
Okay.
the N95 mask is a medical mask with 95%, capability.
Right.
The KN95 represents a Korean standard, which is very, very close to the American standard.
So,
And virtually all the masks you can buy now are KN95.
okay. Bob, Dr. Duncanson, are you okay with what we're suggesting here, a proviso to be put into the order?
Yeah, I'm fine. I was just making notes while the board was talking. Yep.
Okay.
So you want to strongly recommend that mask be either an N95, a KN95, or a surgical, but not specify any particular one, but just in general require a mask be worn at all indoor locations, but recommended it be those particular types.
If possible, right.
Right. And
Yep.
that, Noble, I think previously it's been mask or cloth face covering. So we keep that as the order, or just change it to
I wouldn't say
mask?
the word cloth face covering. Just say mask, because a cloth face covering is a mask.
Okay, so if we say a mask face covering shall be worn, it's implied that you can wear a cloth face covering as has been the practice in the past here.
A cloth mask.
Cloth mask, yeah.
I don't
Right.
think these kerchiefs that look like bandits, I don't think they do anything.
Well, that's the issue for Bob. How is he going to write this? I think you have to keep it simple, and I would go along with the order, goes along with how we've ordered the mask in the past, and then adding the recommendation that Dick talks about. That's what I say.
Okay.
I think more than that, it gets confusing, and we open up a whole can of worms.
And then Bob, we could
So
assume
how did
after we do this that you could post the electronic message board with the corresponding words, correct?
Yes, because right now the message board says, please wear a mask indoors. I was thinking about that when I drove downtown today. We could just change one or two word to indicate that it's mandatory now.
Okay.
Yeah.
So so we don't need a motion now. We're just giving recommendations and ideas for Dr. Duncanson to prepare a document. We don't need to do a motion now.
No, I don't think so. I wouldn't recommend doing a motion until we have something in front of you that you want to vote on.
Okay, that's fair enough.
So we'll wait to hear from
Should
you,
we-
Bob. Bob,
Should we say that we're gonna try to get this accomplished within 3 or 4 days? And
Yeah,
have
we
a
need-
special meeting? Because if we wait 2 weeks, the horses out of the barn.
Right, we got to do it this week. And I would
Yeah.
say, I'd say by Wednesday if we can, if not Thursday.
I agree with
Yeah.
Wednesday as a target date.
Yeah,
Yep.
we can post an emergency meeting for the board.
Good. All right, is everybody okay with this? Any Noble?
Oh, no, I'm okay with that. I had another quick numbers question for Bob about the COVID stuff, if we're done with this order.
I think we're done with it.
Okay, just, Bob, can you say something about hospitalizations at Cape Cod Hospital? My understanding that it's down around 20 people or 30. I mean, it's much lower than the case number. And then what about town employees? Has there been any problem with town employees in some of the buildings?
We had, let's see. We had a town employee in the community center test positive last week. Judy went over the community center today and tested the rest of the employees that were in the building. They were all negative. We generally want to wait that 4 to 5 day period after somebody, is positive before we test other people. So that turned out well. We had an individual here in the community development department who tested positive last week. They were sent home for the requisite, 5 days of, as you know, CDC updated their guidance last week to 5 days of quarantine or isolation, followed by 5 days of strict mask wearing. So they fell into that protocol. I think the DPW case we had was before your last meeting, not since your last meting.
Yeah.
So yeah, that's what we've had. We have tested other people in DPW. Again, that took place last week after the previous week's case. And again, luckily everybody was tested negative. We did get a new shipment. Judy reached out to the state. We got a new shipment of tests that we're using for the town employee situations. So we do have that, and we now have that capability in-house here. And just one thing on the whole testing issue. I'm sure the board is aware because I think you were copied on the information. The state has now made testing kits available through state contracts so that towns can purchase them at cheaper rates. I took a look at it when it first came out, and I subsequently spoke with the Health and Environment Director at the county, Sean O'Brien, because unfortunately, 2 of the vendors on the state's contract, you basically have to buy a pallet at a time. The smallest quantity they will deal with is a pallet, which in one case is like, 17,000 tests. So I called Sean and I said, it makes a lot more sense if the county were to do a procurement. Each town tells the county, hey, we want this many number of tests. Then the county puts the procurement request in because, we're talking in the tens of thousands of dollars here. And so Sean, they had already started those discussions at the county. This came out, I want to say last Thursday. The state finally announced this procurement availability. The county was already having discussions, and he indicated we'd hear back from the county early this week about whether or not the county was going to do a procurement that the towns could basically opt into and say, all right, we want 500 kits for the Chatham and 300 for Brewster and whatever, and then the county would take that and put one big order in, if you will. Would make it a whole lot easier than each town going after them individually. Especially where some of these kits you have to buy fairly large quantities, and you have to be able to deal with pallet deliveries and those kinds of things. So more to come on that here, hopefully shortly.
Bob, that wouldn't be for the general public though, would it?
Yeah, we could then make them available to the general public. As you know, the state made 2.1 million home test kits available, but only to 102 communities, only 4 of which were on the Cape. So yeah, the town of Chatham could, on behalf of its citizens, procure X number of test kits, and then make them available to the public if we wanted to. And I'm not, we still don't have all the numbers. We can use federal COVID-19 ARPA funding to procure them. So that is something that, is being considered, and I would welcome the Board of Health's input on that. I don't need it right now, but, if you want to think about it, and then just, send me an email. Don't send it to everybody, or don't start any violation of the open meeting law. But if you think it's a good thing to do and you have any idea of potential numbers, certainly pass that along.
But Bob, I think every household in town should have a supply. I personally.
And I guess the question is, what does a supply mean? Is that 2 for every person residing here all year, or just in the winter, or,
yeah,
the numbers could get large very quickly. It's got limited numbers under the state's program, which were targeted at low-income individuals, because they couldn't afford the $26 a box at CVS, let's say. So the state does have cheaper rates based on the negotiations they made with the providers. They're not free. The town would still have to buy them. And then we'd have to figure out some way of distributing them as well.
I would say so many per capita, and then have them passed out at a public dispensing clinic.
Okay.
But that's just what I think. That's all. Noble.
If the town had a supply, couldn't they be made available at several of the town buildings, or so that people could come and pick them up, and then with some sort of a limit as to the number that each person could take, and then that way they could get around town and everybody would have access to them, except I guess maybe the elderly, low income area, maybe some could be dropped off at the desk there. But to me, that would be the better way than just to hand them out to people who might have some reason that they don't even want them.
Yeah, we could certainly look at those kind of distribution scenarios. Absolutely.
Richard.
Yeah, I agree. It would be good to have them available. I think we would want to make sure that we had some instructions to people regarding when and how they should be used, because we don't want people just coming in and getting, tests and go home and test and say, okay, yeah, I don't have COVID, if they don't have any symptoms or any contacts. And unfortunately, that's the way a lot of them are potentially being used now. It's really unfortunate they're so expensive. I just had an email from one of my former colleagues who just got back from Germany, and he said he brought a bunch of them back because you can buy them in every gas station in Germany for $2. And here, you have to be lucky to be able to go to CVS and get 2 for $27. But I wouldn't want to see them used for no good reason. I think it's important that people know how to use them. They know that if they have reason to believe they might have been exposed to have COVID, they should test, and they should test it, and then they should test again 3 or 4 days later. So at least 2 tests per person.
Mm-hmm.
Noble.
No, that's an old hand.
Okay. All right, so if anybody else wants to weigh in on that, you can do so with a note to Dr. Duncanson by email. Are we done on this agenda item? My sense is we are. If we do have minutes for December 20th.
John,
I
do you,
get a-
is there public input? I don't know.
Oh, I'm sorry. Yep. Good point. Does anybody from the public wish to comment on any of these issues? Thank you, Noble, for reminding me. I don't see any hands up. So let's proceed with, can I get a motion to accept the minutes for December 20th?
Noble,
Motion to approve, Ron Broman.
Pardon me? Ron?
Make a motion to approve the minutes.
Can I get a
Noble
second?
second.
Second from Noble. All in favor of approving the minutes? I guess I gotta call everybody. I guess we can do by voice. By everybody in favor of accepting the minutes, say aye.
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 I don't hear anybody say no. Okay, motion to accept the minutes is approved.
Hey, John?
Yes.
Yeah, I hate to be a pain, but given the meeting is virtual, you are supposed to do a roll call vote.
All right. I was just trying to facilitate.
I
All
know.
right, when I call your name, please indicate how you vote on the motion to accept the minutes. Dr. Hanson,
Accept.
Ron Broman,
Approve.
Ed Sheehan,
Yeah.
Carol Joyce.
Approve.
I was not at the meeting, so skip me. Dr. Edwards.
Approve.
Okay, thank you. Last thing was we need a motion to adjourn.
Noble, motion to adjourn.
Second, can I get a second?
Second, Ron Broman.
Second.
Okay, when I call your name, please indicate how you vote on the motion to adjourn. Dr. Hanson,
Adjourn.
Ron Broman,
Adjourn.
Ed Sheehan,
No.
Carol Joyce.
Adjourn.
I vote to adjourn, and Dr. Edwards.
Adjourn.
All right, so we're all done. Thank you, everyone, for your participation, and we'll look forward to reconvening later this week. Thank you.